my name is Corey. This is my video portion for the module on PTSD and Nursing 730. And we're talking about a young gentleman, 21-year-old, named Yang, who was in a car accident and is experiencing nightmares, reliving the events, avoiding feelings, places, people, things that trigger this for him, and just his functioning and his everyday life is struggling. And so to talk about post-traumatic stress disorder, PTSD, briefly, it is a mental condition triggered by a terrifying or life-threatening event. The symptoms are generally grouped into four main types. One is re-experiencing the trauma, avoiding the reminders of the trauma, negative changes in mood, and being highly on edge or reactive. So the medicine that I thought would be great for Yang is prazosin. And so let me get back to that. I chose prazosin because it is a blood pressure medication, but it has this is an off-label use for prazosin, but it targets relief for the sleep-related PTSD symptoms. So Yang is having symptoms of not sleeping well, nightmares, and prazosin has been shown to specifically help reduce nightmares and improve overall sleep quality for many patients who have PTSD. And this can also roll down into positive effects during the day, having a better daytime mood, less anxiety, and better everyday functioning. So the prazosin, it's an alpha-1 adrenergic receptor antagonist, and it blocks off noradrenergic overactivity during sleep. So during PTSD, adrenaline can be hyperactive, and so prazosin can help turn that off. It tends to reduce nocturnal arousals and intrusive thoughts that disrupt sleep. So prazosin can be used as a standalone medication, or it can be used with an SSRI, SNRI, and other therapies. So it's pretty tolerable for many patients. It's started pretty low and titrated up. The side effects are generally pretty manageable, and it also is not sedating like some sedative antidepressants can be, which is it's great for patients. Let's see. If prazosin is maximized or is not working, we can try other alternative alpha blockers. Terazosin or doxazozin may also work in the same way and stay in the body longer. And then antidepressants like sertraline or paroxetine are widely used to improve overall PTSD symptoms, including the anxiety and negative moods. So this can work with the prazosin. So the scenario that we're supposed to comment on in this assignment was that he came back in, Yang did, after starting prazosin, and isn't really feeling any different. And so what can be done about that? After research, I would explain to him that it is started at a very low dose, and it can take quite a bit of time for the prazosin to take effect. So I would review the dose and see if there's room to increase it. as well as add an SSRI like sertraline, and talk to him about his therapy. It does say that he started therapy, so I would tell him to continue those sessions, because therapy is actually the best treatment for PTSD. But I would also request or refer him to having imagery rehearsal therapy, which is IRT. This is a specific type of therapy often used for chronic nightmares due to PTSD. So it would give Yang some tools to rewrite the endings of his bad dreams, and basically taking away their power. So education around prazosin for Yang. If it's not helping your PTSD yet, don't worry. It's common to have to adjust the doses. Prazosin does not treat all of PTSD. It's primarily to help stop the trauma, nightmares, and improve the quality of sleep. So if the dose is too low, then we can start increasing. There's a lot of room there for flexibility. Also, I would tell Yang that prazosin leaves the body really fast, so it has a short half-life. If it wears off too quickly, then definitely a dose will have to be increased, or maybe the timing of when he takes it. Maybe he needs it twice a day instead of once a day. So therapy also, besides the IRT, he could have therapy like cognitive processing therapy, which work really well along with the medication. So as a PMHNP, I would be focused on balancing the clinical knowledge with patient-centered care, and that means basically meeting the patient where they are. So this is important for me to take consideration. Let's see. So in thinking about how PTSD affects my own personal beliefs, I do have to be really aware, because I'm someone who has experienced PTSD in my lifetime and has had to be treated for it, whether it was secondhand through my work, because I was a flight nurse and a trauma nurse for some time. I did have to get therapy. I was on prazosin and I was on SSRIs. So I have to be careful that I'm not projecting my own experience, even though it does help me to have empathy, but also not project what worked for me, as far as if that would be the answer for Yang. So I might accidentally judge the situation based on my personal biases and experience. Sometimes patients don't adhere to the treatment plan, and so this might cause me to have some emotional reactions or judgment, and understanding that PTSD is a neurobiological condition, it takes away from personally judging the person, and can align my clinical care decisions by separating. I could feel frustrated and assume that Yang is not trying, but I can certainly remind myself that I'm not there to be judgmental or to project my own biases. So and that's really all I have. There were a lot of questions after about not having an emotional reaction, and how to best provide for Yang. And so I think if I am understanding that in PTSD, that the amygdala, the brain sphere center, is overactive, this is not Yang's fault, which is why he's in treatment. And so just really having the patience and compassion and empathy to just ensure that he's having, he's fully educated and aware about treatment options, so that he can have his own autonomy and be a part of the decision-making process. I think in PTSD, a traumatic event can really take away a person's sense of control in their environment. And so especially with a patient like Yang, giving back some of the control to him and saying, here are the options and side effects, and what is it that's working for you? How can I be there for you to best support your healing journey? So I do know that healing from a traumatic event is completely possible, and many of us do that. So just to know that there's always hope and that things do get better is important to give Yang that sense of hope. So that's all I have right now. Thank you so much, and I will see you next time. Bye-bye.